On to financial management, which is a very unhealthy state in the public health sector. And that's the findings of the Rural Health Advocacy Project report, which looks at public spending and procurement over the last 5 years. And to find out what went wrong and how the sector can be nursed back to good health, we have Russell Rensburg, the director of the project. He joins us this morning. Good morning to you, Russell, and thanks so much for your time. What is the state of the healthcare financial status? Hi, you muted, Russell. There we go. Morning.
No, I think I still have those. Good morning, Cindy, and thank you for the opportunity. Look, the state of public finances generally is not in a good space, right? And basically, we did our report to try and understand how best we can continue to advocate for the rights of rural communities and ensure that they continue to have access despite the economic challenges we face. So there are a couple of things happening at the moment. We know that since 2012, funding for healthcare has been really flat and needs have expanded. But the financial management practice, and particularly the management of procurement practices, contributes to significant inefficiencies within the system, actually leaving less money available to implement on healthcare. And that all spills into poor audit outcomes and so forth. But hey, at RAP, we like to look forward. So we use these reports really just to try and understand what are the things that we need to prioritize. But the current state and over the last 4 years hasn't been great.
All right, give us an indication, maybe in terms of the financial or the annual allocation to the health department, for example, in this current financial period under review. What has gone to waste in terms of percentages and with the procurement processes being flouted, precisely what the picture looks like?
I think over the last year, I mean, I'm not going to be able to talk. Overall, the budgeting for health is around 250 billion rand a year, right? That money is separated between national and provincial in line with the constitution, where health is a concurrent responsibility. But the bulk of the money really gets transferred to provinces, who are the main deliverer of publicly funded healthcare services. Now, provinces obviously are subjected to the PFMA, but 60 to 65% of the money is really spent on compensation of employers, and around 30% is spent on procuring goods and services. And these could be anything from medicines, consumables, food, security services, and so on. So it's quite a significant portion of provincial budgets. Now, based on audit outcomes, I think the biggest indicator of poor financial management capacity or compliance really lies in the area of procurement, where we see that irregular expenditure in the last year, based on the report prepared by the Southern Centre for Studies in Inequality, really amounted to about 6 billion rand in total. So, but as a net percentage, it's probably not very big. But we think about the impact of that waste on already constrained resources within the health sector. The impact is significant. And a lot of the contributors to that is poor procurement management, and then secondly, things that are not budgeted correctly. For example, the claims that are paid for medical legal claims, which are significant. Yeah, so I think we need a complete overhaul of how we think about healthcare spending and management and budgeting in particular, if we are going to ensure over the next 3 years that we are able to continue delivering services to the communities that so desperately need it.
So is it a case of lack of competence? In other words, not understanding the financial processes, or maybe the systems being susceptible to manipulation, that you can override just basic procurement principles and policies that we see this kind of activity perpetuating? It's just easy, maybe because there are loopholes in the system. Why is it that supply chain management is the consistent problem?
Well, because, like I said, 30% of that budget is on procurement. We've seen in some things like the Zondo Commission that procurement or flouting of procurement rules is the way that corruption happens within the system, right? So I think it has to firstly start on the political accountability level, right, where we have to be a little bit more direct and specific around the responsibilities of the government and the responsibility of Parliament in overseeing the state to ensure that we stick to these regulations, because we generally have quite good regulations. but the substance of them aren't well maintained. So if we don't budget correctly as well, so if we don't budget correctly, we end up overspending and we end up doing activities that weren't budgeted. We don't always manage for cost effectiveness. And sometimes emergency procurement is one of the significant thorns in our side. But at the base of it is really about looking at our overall system of accountability. Because just having policies on their own doesn't ensure that we have that kind of compliance.
Yeah, and Russell, I was going to say, because of the culture of
spending.
impunity, maybe that's why, we haven't really seen meaningful convictions or anything to write home about in this regard, that the cycle just perpetuates itself. But yeah, we're just going to have to leave it there in the interest of time. We really, really appreciate you coming on this morning.